Good evening. My name is Deirdre Davis, and I'm here to talk to you about virtual reality as it pertains to the medical profession. I'm sorry I couldn't do this on Engage XR, but I couldn't get into my account. In any event, I'm here to explain how VR or virtual reality is a good thing for the medical profession. Virtual reality, first of all, is when you immerse yourself, usually with a headset and hand gear, into a place where you feel like you're really there. You can do it like you're going cross country or something like that. But in the medical profession, you can put yourself in emergency rooms, you can put yourself in operating rooms, and you can see things with virtual reality that you can't see with your natural eye. Virtual reality is good for the medical profession on two accounts. One is good for the patient. Let me explain. I've had open heart surgery 4 times, twice as a kid and twice as an adult. I'm not sure if it would have helped me when I was a kid because I was too young to understand the long words that the doctors throw at you when they're trying to give you a diagnosis of something. However, the last 2 times I was an adult. And I think it would have helped a lot better had I known what they were saying to me. They wind up finally explaining it to me in layman terms, but it took a while. If they had explained it, or if they could explain it to the patient while he or she is looking through the virtual reality lens, they could explain it better. Then they wouldn't have so many problems with people having their pressure to go up or having difficulties before surgeries. You see, when you can see something in real time, for instance, if I had been able to see my operation, to see my heart, and to see what the malfunction was and what they had to do or what they said they were going to do to correct the problem, I think it would have been a lot better. I wasn't nervous only because I believe in God and I know He had me. By the same token, a lot of folks don't believe in God, but that's another story for another day. When you can see the problem and they show you how they meaning the doctors, intend to correct the problem, it makes it a lot easier to digest. When you have a family member or a loved one with you who can help you understand what is going on and what the doctors are actually saying, that makes it easier too. Because now your mind is at ease, your heart rate is not, speeding up, your pressure is stable, and you want everything stable when you're going to have a procedure or a operation. The patient will have a better frame of mind because he or she, when it was me, to see what is going to take place, how they're going to do it. It answers questions that you might have had you not seen it for yourself. Virtual reality will show you how the doctors can repair it. It's like you're in the operating room with them. And even if it's an assimilation, you get to see it. You can watch it with the naked eye. You can watch it on the screen that they normally have in the operating room so that they can see what they're doing too. They don't just go in blind. But whatever the procedure is, whatever the problem is, if the patient understands what it is they're getting ready to endure, I believe it makes it better. Better for them and better for the doctor who's doing it. Because when the patient doesn't understand and or the doctor has not explained it satisfactorily to the patient, Then you have all of the questions. You have, the nerves that start to bubble up, and you have difficulties that don't need to take place. I believe that virtual reality could help soothe the mind, the heart, the soul, because now they understand it. They've seen it. They know what's supposed to take place, even if that's not all that happens. Because, let's face it, there are difficulties sometimes. Things do come up. The doctors will be able to explain it. They will even understand it themselves, especially the interns who are coming in. Usually they watch the procedures and the operations from the observation deck. And unless they're watching the screen, they can't see a whole lot of stuff either. But it would be better if they had virtual reality where they could see it too. They see the surgery or whatever in real time and whatever's going on. But if they had virtual reality in the medical profession, the instructors could teach them while they're in school. So they already have a better frame of mind of what it's going to look like. And when they explain it to the patient, they have a way that they can, their bedside manner, I guess they call it, that they could explain the procedure, the after effects of what's supposed to happen. Because what's supposed to happen what does happen is not always the same thing. But let's face it, complications happen. But all the way around the board, everybody has a better understanding of what's supposed to take place, how it's supposed to take place, and what the desired outcome is supposed to be. So what I'm saying is that you don't have to sit up in a doctor's office watching a skeleton that he has standing near the closet, or a heart that's on a desk that he can point to certain things, but he or she can't show you what they're going to do and how the blood is supposed to flow. They can tell you, but we're visual people. We, meaning humans, we like to see. So if they could show us in real time, it would be easier. They've done some videos with showing you how it goes, but it's not virtual reality. It's just a film. And with that film, they still don't show you but so much. So what I'm saying is that if they use virtual reality to explain to patients the different procedures and operations that they intend to perform on people, it may go a long way, a longer way than normal, for both the patient and the doctors. Because then we get to understand it better what the insides of our body is supposed to be doing. And when it doesn't, or when there's something wrong, we know to tell the surgeon that, oh, well, this hurt, that hurt. And well, I feel this or I don't feel that. And when they ask you questions, you're not looking at them like, I don't know. So what I'm saying is that it could help both people, the patient and the physician, to learn a lot more of the body, of the procedures, and then put everybody's mind at ease. That's what I think virtual reality should do for the medical profession. It's even more complicated when they have to go into your brain for aneurysms and stuff like that. I think people will still be worried, but maybe not as much, because they get to see what's really going to happen. They don't usually have a brain sitting on the desk to show you how everything is supposed to go. So, yeah. Virtual reality in the medical profession would bring it a long way. Technology has come a long way, but if it did that, it would really, really help both the profession itself and the patient who has to endure it. Thank you for listening. Talk to you soon. Bye.